Thank you for your interest in our efforts to create ecosystems for healthy lifestyle. We're doing this to address the problem of our toxic lifestyle killing us and making us go broke. The focus of this short presentation is our proposed solution, harnessing the power of lifestyle as medicine. We know it works, but we also know that few people have access. My name is Michael O'Donnell, and I'd like to tell you our thoughts about this approach. So the basic idea is that lifestyle can reshuffle the genetic deck by changing the expression of our genes. And it works something like this. Genes cause disease, which causes premature death. But lifestyle can actually reduce the prevalence of disease by changing our genes, especially by changing how they're expressed. The result is reduced premature death. Now, the best estimates are that lifestyle can reduce overall disease prevalence by up to 78%, and for diabetes, up to 93%. Now, what is healthy lifestyle? It's being physically active, eating nutritious foods, avoiding toxins, especially tobacco, excess alcohol, and drugs. It's getting enough sleep, cultivating meaningful relationships, managing emotions, and getting medical care when it's needed. Now, there have been thousands of cases documented that lifestyle medicine can improve health and save money if done right. And this has been shown for individuals, for employers, for communities, in national campaigns. And I'd like to share a few examples. So in this study, it was a randomized controlled trial of people who had documented coronary artery disease. And compared to the usual care, this study showed that in terms of myocardial perfusion abnormalities, PET scans showed improvements in nearly 100% of cases. And the results that were true at 1 year actually lasted and were found at the 5th year of study. And there's been more than 3,000 citations of this study. There's been small and large group publications, and this is covered by Medicare and by some private insurers because it improves health and reduces costs. In this study of diabetes prevention, randomized controlled trial with more than 3,000 people, they found that compared to the placebo, the usual care, with metformin, diabetes was actually seen in 31% fewer cases. The lifestyle outcome was actually almost double that, and it was more than double that for people who were 60 years or older. Now, these results actually lasted 15 years of follow-up. There's been more than 14,000 citations. It's been replicated in small and large groups, and this too is covered by Medicare because it improves health and reduces costs. Now, an example from an employer setting, the Cleveland Clinic, which is a huge employer with more than 200 locations, more than 50,000 employees, comprehensive employee program called Healthy Choices, which included efforts to improve awareness of the link between lifestyle and health, several things to motivate employees, including a reduction in the health plan premium cost if they participated and achieved goals, skill building efforts focusing on 20 different chronic diseases and the major lifestyle areas, and many opportunities to practice a healthy lifestyle. And the focus was on normal values for 6 main areas, plus seeing a primary care doctor regularly and being up to date on immunizations. So 69% of employees and spouses enrolled, and what they achieved by 2018 compared to 2008. Counting the number of employees who either had normal values in these 6 areas or were on track to have normal values, plus the 2 behaviors, the number increased from 6% to 43% of the entire eligible employee and spouse population. Now, these employees saved $50 million in lower premiums charged by the Cleveland Clinic because they participated and or they achieved their health goals. Now, the Cleveland Clinic on the other hand, saved $260 million in reducing the rate of increase of medical care costs. Now, looking beyond the Cleveland Clinic, there's been 47 studies in this meta-analysis, or this systematic review of the literature, and 46 out of 47 saved money, and 41 out of 47 saved more than the cost of the program. And the average return on investment was more than 2 times the savings. In terms of national campaigns, the Federal Drug Administration has been focusing on trying to prevent teenagers from smoking. And among 10 million teenagers, 12 to 17, who are susceptible to starting or starting to experiment in a program called The Cost to My Mind, The Cost to My Body, and The Cost of Just One, they have developed a sophisticated media campaign costing nearly $250 million over a 5-year period. And the goal is to reach these teenagers, 75% of them, 15 times every quarter of the year for 5 straight years. They've actually reached 95% of the target 20 times every quarter for 5 years. And they've prevented nearly 350,000 teenagers from starting to smoke at a cost of only 10 cents per exposure, and per quality adjusted life year, just $1,300. Now the ROI from this very expensive campaign, it's more than $100 for every dollar invested. So the message from this one is the therapeutic dose will cost more and it'll be more effective. So I said there are thousands of documented successes. There's also thousands of failures. These examples I've shared, there are many of them, but they are the exception compared to the failures. They work because they deliver a therapeutic dose of best practice strategies. Most efforts that we discover in communities and in work settings and clinical settings, they're too superficial and they use ineffective strategies. In fact, we have discovered that most people do not have access to effective programs and campaigns. And this is really one of society's most damaging health disparities. Our estimate is that only about 4% of employees have access to comprehensive lifestyle change programs in work settings. And in other settings, they're really not very prevalent. So our goal is that everywhere people work, learn, play, pray, they'll have access to ecosystems that inspire, enable, and sustain healthy lifestyle. So this solution is what I've been working on with 10 volunteer colleagues. Collectively, we have several centuries of experience improving health by harnessing lifestyle as medicine in clinical, corporate, community, policy, entrepreneurial, and academic settings. And we're also parents and grandparents and aunts and uncles and neighbors of all the children of Colorado. And our goal is to give them the best opportunity to achieve their dreams because they have healthy lifestyle and good health. Now, I encourage you to visit our website, ecosystemsforhealthylifestyles.com. It has this recorded short presentation. It also has 2 other short presentations on the problem and our approach, as well as more in-depth presentations, a white paper, and an opportunity for you to get involved to work with us. So look forward to working with you. Thank you for your interest.